Hi, I'm Father Kyle Shinseki, and we're here at the Markkula Center at Santa Clara University. And I'm here today with Dr. Charles Binkley. We're going to be talking a little bit about COVID-19 vaccines.
I'm Charles Binkley. I'm a physician and a bioethicist, and I direct the bioethics program here at the Markkula Center for Applied Ethics at Santa Clara University.
So, Dr. Binkley, first of all, how effective are these COVID-19 vaccines? How do they really work?
Father Kyle, they're very, very effective. They're among the most effective vaccines that we have. To give you an idea, all three of the vaccines approved for use in the United States are greater than 85% effective at preventing severe cases of COVID infection. And they're all 100% effective at preventing hospitalization and death from COVID. You can't really get any better than 100%, so they're extremely, extremely effective.
Some folks have raised some concerns, though, that how quickly this process was approved. Could we really be sure that they're safe?
The process was quick, and that was because there was such a need to get people vaccinated to prevent deaths from COVID. But the vaccines are extremely safe. They were tested first on tens of thousands of volunteers of different genders, different ages, different races, and nationalities. And there were no significant safety concerns in that initial group of volunteers. Since then, millions and millions of people throughout the world have been vaccinated, and there have been no consistent safety concerns as it's been rolled out even more broadly. The biggest concern would be an allergic reaction. That occurs 3 to 5 times per 1 million vaccines that are given. To put that into context, the common drug penicillin has a risk of 1 severe allergic reaction every 10,000 times it's given. So much, much safer than is even penicillin when it comes to risk.
Now, other people have raised the concern, well, I can't afford to have side effects. I have a job, I have a family. I can't afford to be away from those responsibilities. What would you say to them?
Yeah, that's a great question. Most of the side effects associated with the vaccines are relatively mild. So for instance, you can have some pain at the injection site and it can be sore. You can have some muscle soreness. You can have some mild fevers. Some people report being fatigued or having a headache. So they should all be very self-limited. If you have severe symptoms or if they persist for several days, you should contact your healthcare provider.
And who is currently eligible for the vaccines?
Here in California, everyone 16 years of age or older, they're all eligible. And they're eligible, it doesn't matter if you have insurance or not. There's no cost to receive the vaccine. You don't have to pay for it. You don't have to be a citizen. You don't have to be a resident. Anyone can get the vaccine, ages 16 years or older.
And why should someone get the vaccine?
Well, on the most basic level, people should get the vaccine to prevent themselves from getting COVID and from dying or becoming ill. You should also get the vaccine to protect your family, your friends, your community. Our Holy Father, Pope Francis, has received the vaccine, and he tells us that we have a moral obligation to receive the vaccine out of love for our neighbor and as an act of charity. Also, just on a practical level, to start to do the things that we enjoy doing again. I haven't seen my mom in over a year. Now that we're both vaccinated, I can see her. That's been true in so many families that they've been separated from each other because of fear of either getting infected or infecting someone else. Same thing is true in communities of worship. People haven't been able to worship together. Schools have been closed. And so to be able to return to the things that we enjoy doing, we're going to need to be vaccinated.
And how can someone sign up for a vaccine?
So here in California, you can go to myturn.ca.gov, and that will help to direct you to a vaccine site. You can also contact your local health department or your medical provider.
Great. Thank you very much, Dr. Binkley.
It was my pleasure, Father.
So I hope that this conversation has been helpful for all of you out there in our parishes across California. Hopefully it's helped to ease some of the concerns that you have had or others that you have encountered in your parishes have had. And once again, thank you to the Markkula Center here at Santa Clara University for hosting this conversation.